Did you know the clitoris is anatomically almost identical to the penis? Hi, I'm Dr. Claudia Six, clinical sexologist and men's health expert. And in this video, we're shifting focus because understanding female anatomy is just as important for men's health, relationships, and communication. Today, I'll walk you through 5 fascinating facts about the female genitalia that most people, including many adults, simply don't know. Let's start with the clitoris. The clitoris and the penis are what we call embryological homologs. That means in the early stages of fetal development, they were the exact same structure. As the body develops into a male or female form, that structure becomes either a penis or a clitoris. But the tissue, nerves, and blood supply are nearly identical. Both organs contain erectile tissue called the corpora cavernosa, which expands with blood flow during arousal, and both are highly sensitive to touch. In fact, for a long time it was believed the clitoris had around 8,000 nerve fibers. But a more recent study, using microscopic imaging of clitoral tissue, found it's actually closer to 10,000. That makes it one of the most densely innervated parts of the human body and possibly the only organ we know of designed entirely for pleasure. That brings us to number 2. The clitoris has a foreskin. It's called the clitoral hood or prepuce, and it functions very much like the foreskin of a penis. It protects the sensitive glands of the clitoris from friction, irritation, and infection. But just like the foreskin in men, it can sometimes cause problems when oils, skin cells, or moisture build up under the clitoral hood. It can lead to inflammation, pain, or adhesions, where the clitoris becomes partially stuck to the hood itself. This is very similar to a condition in men known as smegma buildup. In some women, these adhesions cause no symptoms, but in others, they can make touch painful or orgasm more difficult. In these cases, there is a simple, office-based procedure called clitoral adhesiolisis, where the hood is gently separated from the glands, though not widely studied. One study of 41 women showed very promising results. 76% reported improvement in pain and 63% had better sexual arousal after the procedure. Now, let's talk about something else that varies far more than people realize. Number 3. The labia minora. The inner lips of the vulva are as unique as a fingerprint. They come in different colors, shapes, sizes, and lengths. Some are symmetrical, others are not. Some protrude beyond the outer lips and some don't. All of this is completely normal. Unfortunately, many people compare themselves to digitally altered images, especially in pornography, where the appearance of the vulva is edited to match narrow, unrealistic ideals. But in real life, variation is the rule, not the exception. During arousal, the labia minora can swell up to 2 to 3 times their normal size and change color, often becoming deeper red or purple just before orgasm. These changes are temporary and completely natural. Which brings us to number 4. The vagina increases in both width and length during sexual arousal. When the brain gets signals from the body that it's ready for sex, several changes occur. The body produces lubrication and the vaginal walls expand to prepare for penetration. In the non-aroused state, the vagina is usually around 3 to 4 centimeters wide and 8 to 9 centimeters deep. But during arousal, it can stretch up to twice its original size. This ability to expand and return to normal is why the myth of a loose vagina after sex is just that, a myth. The vagina is flexible, elastic, and designed to accommodate both intimacy and childbirth. It does not become permanently stretched from sexual activity. And finally, number 5, the vagina is self-cleaning and it has its own microbiome. Thanks to estrogen, the vaginal Environment maintains a naturally acidic pH and is populated by protective bacteria, especially lactobacilli, that help keep infections out. That's why douching is not recommended. It disrupts the balance of good bacteria, raises the risk of infections, and can cause more harm than good. If you're dealing with recurrent vaginal or urinary tract infections, it could be a sign that the vaginal microbiome is off balance. This is especially common in women who are postmenopausal, have undergone surgery, or are on medications that lower estrogen levels. In these cases, using localized vaginal estrogen can help restore the natural balance and protect against infection, particularly urinary tract infections. When it comes to hygiene, the vagina doesn't need floral scents, harsh soaps, or cleaning on the inside. The best approach is simple. Use mild soapy water on the outer hair-bearing areas and let the vagina do the rest. It's designed to take care of itself. And yes, it has its own natural scent. That's not a flaw. That's biology. I hope this video helped you see just how complex, intelligent, and resilient the female body really is. And if you're someone with a female partner, understanding her anatomy is one of the best ways you can build trust, intimacy, and mutual respect. I'm Dr. Emma Blake, urology and men's health expert. Take care of yourself and those you care about, because you're absolutely worth